Good morning. I'm Dr. Raymond Douglas of Beverly Hills, California, and today welcome to another episode or segment of Thyroid Thursday. What I'd like to talk today a little bit about is the social impact of Graves' disease and thyroid eye disease. And what I think many people don't realize is just how profound the impact of this disease can be. So this Thyroid Thursday is really dedicated to the families of patients with Graves' disease or thyroid eye disease, because I think it helps to understand the perspective that so many of our patients go through each and every day. So I'm going to discuss two patient stories which I think are really profound and bring this point home. But first I'd like to set the stage that, this disease affects how you feel every single day. It affects, whether your hair pulls out and you lose hair in the morning, whether you have no energy to get up, or whether you have so much energy that your heart is racing all the time and you can't sleep at night, or whether you're sometimes feeling so cold in an environment that you're wondering what's going on, or that you're sweating all the time. And these can bounce back and forth. And then all of a sudden you get hit with the eye disease or the thyroid eye disease component of this horrible disease, Graves' disease. And then all of a sudden your face changes. Not only your eyes, which your eyes kind of bulge out, they can become really uncomfortable. In pictures, you all of a sudden notice that you're staring and you're not sure why. But also the other facial features, even the facial features that can happen lower on into the face, into the buccal fat that I often remove for patients because the facial shape changes so much. And in the eyebrow, where you can have these hot dog areas of eye bulging. And it's variable from patient to patient, so no two are exactly the same. So you take all those things and you wrap them up into the social impact of the disease, and it really can become quite profound. So one of my patients, quite a few years ago, about 10 years ago, presented, and he had been on a pretty dramatic downward spiral. He was about 35 and doing very well, working every day. He was actually in the software field. And he got this disease, and it's totally disrupted his life to the point where he really just couldn't function. He couldn't get up in the mornings easily, and then his eyes began to bulge out, and then they began to cross. And it became so disruptive to his life that he actually lost his job and moved back in with his mother and went on state assistance. Until after we did the surgery and moved his eyes back, straightened his eyes, and then I found out about 6 months later he was back employed and doing things. So instead of being called out at the grocery store or people asking, hey, what's wrong with you, he became part of life again. And no matter how many studies we do, this type of a story really tells us the impact of the disease. The studies have all shown us that this disease is just the same impact to patients as having breast cancer. It interferes with their quality of life to that extent. The other story that I'll show you is before and after photo of just a wonderful patient of mine from Chicago. And many of my patients come from out of town to visit and to see me. But this patient came and we did surgery just to move the eyes back. Didn't really need any eyelid surgery, and we tried to do everything all at one time. And I got this wonderful note of how her life had changed. So instead of dealing with people, calling her out and I won't say her age, but being very young and single, instead of people, wondering what's going on, why are your eyes look so strange, all of a sudden now she felt the confidence and to live a normal life. And that's what most people want, is just to live a normal life and to go back to the way they were. Well, her note, showed her and her new baby on the 5-year anniversary of her orbital decompression. And that was pretty profound to me, because that's kind of what we do, everything that we do for is to have those types of moments. So this Thyroid Thursday is devoted to the families, the friends, and everyone else who surround our patients, and give them the support they need through this really tough time. And we're always here, and we have many patients who really volunteer their time if you'd ever like to hear a patient's story or speak to them directly. We never ask, but they volunteer out of their own, out of their own goodness of their heart, because they understand how profound this disease can be. Anyway, thank you very much for joining us today, and our contact information, if you want any more information, is to come. Thanks so much.